Hello everyone, welcome to my channel. In today's lesson, we are going to be focusing on the care plan for patients with enteral feeds. What are our roles and responsibilities as nurses when we're caring for patients with enteral feeds, and how can we maintain the best possible standard of care? Enteral nutrition, what is it, you may ask? So it refers to the delivery of a nutritionally complete feed directly into the stomach or intestine using a narrow tube. It is normally considered when a patient is unable to meet their nutritional requirement due to unsafe or inadequate oral dietary intake. Now it can be inserted into the stomach or intestine via the nasal, oral, or percutaneous routes, and it can also be used for gastric drainage or decompression, sometimes in the setting of bowel rest or small bowel obstruction. Most institutions will have the kangaroo pump or the kangaroo e-pump enteral feed. Now it's easy to use, so if it's your first time using it, you'll be very okay. It's intuitive, it's simple, it's small, portable, and you'll also be needing your feeding sets. Now on the right is the dual set, so you'll be able to apply your feeds to that purple bag and your flush to the blue bag. On the left is your gravity set or your drip set, and this is used in different settings. Now there are different modes of delivery. The physician may order continuous feeding, where the patient is on a 24-hour feeding schedule. They may order intermittent feeding, which is normally stopped for 4 to 6 hours, either day or night, and bolus feeding, where there's rapid administration of a prescribed volume of feed or water by syringe over 15 to 60 minutes based on how the patient tolerates, of course, and it's repeated at regular intervals throughout the day. You will also see mentioning of a cyclic schedule, and that's quite similar to intermittent feeding, where it's less than 24 hours. Now you have now been assigned a patient, and the nurse prior to you told you that this patient is on enteral feeds. First things first, check your order. Does it match the kangaroo pump rate for the feeds? You're going to check the type of feed that's at the bedside, the flush frequency, the flush volume, and the prescribed feed rate, and ensure that those are aligned. You will be needing to check your tube placement. For the nasogastric or orogastric tube, there will be markings on the tube for positioning. You will need to check this and reference it to that initial amount that is left out when that tube was initially placed into that patient. The entude, gastrostomy, BR balloon retention feeding tube will have a marking on the bolster, and this is right on the right side of the slide, as you can see, and there is the balloon that will be inside the patient's stomach, and this is going to be where the skin is, and you'll see the markings here, right? So you will need to measure this to ensure that it hasn't been dislodged and it is still okay to use. So your next task will be to check your bags. Check the date on the feed, check the date on the flush, and these should be changed every 24 hours. There is a sticker that's in the feed bag, and these should be filled out each time you're changing these bags. Okay? Next, Check your pump. Ensure that feeding pump is plugged in. Check the battery life and clear any alarms. So you'll also be needing to check your insertion site. For nasogastric or orogastric tube, you'll be checking the skin on the securement device for skin breakdown. You will inspect the buccal or nasal cavity every shift. And if any mucosal injury is noted, the tube position or placement may need to be changed. If there's a nasal tube in place, you'll also be monitoring for evidence of increased nasal drainage, fever, increased white count, which might suggest sinusitis, and this will mean that the physician will need to be notified. For PEG tubes or G tubes, ensure that there's no drainage. Ensure that the dressing is dry and intact and there's no evidence of infection. You will also need to check your equipment. So ensure the feeding tube that all the clamps are open. Check the date on that sterile water bottle. Check the date on the catheter tip and the basin, and these are to be changed every 24 hours. You'll need to assess your patient for feeding tolerance, evidence of nausea, vomiting, abdominal discomfort, pain or gas, or constipation and diarrhea. You will also need to assess for dehydration, and this is evidenced by very dry skin, reduced skin turgor, dry mucosa, reduced urine output, very dark or concentrated urine, low blood pressure, increased heart rate. As primary nurses, other ways in which we can promote safe enteral feeding is by maintaining the head of the bed at least 30 degrees and ensuring that if the head of the bed cannot be elevated, that we are documenting the reasons. Ensuring that we're flushing the feeding tube before and after medication administration with at least 30 ml of sterile water. And as much as possible, catheter tips should be used for enteral administration. There have been cases where products used for intravenous therapy have been mixed up with those used for enteral feeding. Maintaining tube patency. Blocked tubes may be flushed with pancreatic enzymes dissolved in sodium bicarbonate, and of course you'll need a physician ortho for these. Remove any residual medication from your syringes and change them as needed. Monitor residuals, and of course follow your institutional policies for monitoring gastric residual volumes. And also remember that you do not check residual volumes if that feeding tube is in the small bowel. So that's the jejunal or fine bore NG tubes should absolutely never be aspirated. Nutritional monitoring of enteral feed. So your height and weight, at least on admission and as needed. Your biochemistry will be done until the patient is stable and as clinical indicated. Bowels should be monitored daily. Urine output should be monitored daily. Blood sugar levels daily or as clinically indicated. Wound staging daily. Nutritional impact symptoms, and this includes your nausea, vomiting, appetite, and you're also monitoring that daily. Any feeds delivered. So is the feed rate correct? Has the patient received the prescribed amount of formula? Any reasons for feed interruptions? Regular tube flushing? Any care that you did to that PEG site? And the correct taping of the NG tubes? And you're also going to be checking and documenting tube position, length, and marking. Okay? And remember, if ever a PEG tube is dislodged, you are going to be inserting a temporary tube. For example, a Foley catheter should be placed in the tract to prevent tract closure, which sometimes starts anywhere between 8 to 24 hours. Thank you for listening to today's lesson. Remember to like, share, comment, subscribe.